Okay, so it's noon. We're going to go ahead and get started here. If you don't know me, my name is Jessie Thompson. I am Bob's daughter, and before I came over about 3 years ago and started working here at Bob Benny Wealth Management, I worked with an insurance agent for about 4 years, helping people with lots of different kinds of insurance, life insurance, but also Medicare insurance. And so I've been helping people with Medicare insurance for about 7 years now, and I am insurance licensed. So we thought it would be a good idea, since Medicare Open Enrollment starts tomorrow, October 15th, to do a webinar on Medicare Open Enrollment and kind of briefly review the basics of Medicare coverage and what your options are for insuring your portion of the costs of Medicare. So we have a question box down at the bottom. It looks like a little text bubble for Q&A. If you have any questions while I'm going over things, feel free to type those in and I'll go through them here at the end. We're going to take about a half an hour. It might be a little bit less than that. So things are going to be pretty brief, and I know that Medicare can be kind of complicated. So if there's any questions that you have that don't get answered in this webinar, or if you are wondering about your specific situation or anything like that, feel free to shoot me an email after this or give me a call anytime, and I'd be happy to help you out with any of your Medicare questions. So let's go ahead and get started. So Medicare Open Enrollment runs from October 15th to December 7th every single year. It's for people who are already receiving Medicare benefits. So it's not like a certain time of year where you have to sign up for your regular Medicare or anything like that. It's if you're already on Medicare and you've chosen the way that you're going to insure your Medicare costs, you have a couple of different choices of changes that you can make during this time of year. So let's talk about what you can and cannot change. What you can change is if you have a Medicare Part D prescription drug plan, you can join, change, or drop your Part D plan during this time. Additionally, if you have a Medicare Advantage plan, so that's one of these bundled Medicare plans that we'll go over and talk about here in a little bit, you can join, change, or drop one of those during this time as well. So any changes that you're going to make during this time are going to go into effect January 1, and they'll be for all of next year. So these will be for 2022. Now, a specific change that you can't make during this time that I want to talk about is if you have a Medicare Supplement insurance plan, you can't make any changes to that during this time. So if you have a Medicare Supplement insurance plan, you actually can't make any changes to that plan, whether you want to change, if you want to change the specific plan you're on, or if you want to change companies, you can't make any changes to that without going through an underwriting process and filling out like a health questionnaire, if you ever want to make changes to those. So those are pretty kind of permanent policies, and you don't have to worry about making any changes to those during this time. The good thing about that is that the benefits on those policies don't change from year to year. The benefits are never changing, which is why you don't need to look at changing it every year. The benefits on Medicare Part D plans and Medicare Advantage plans, benefits, formularies, premiums, deductibles, every part of those plans is going to change every single year. And your prescription drugs might change year to year. So that's why it's a really good thing during Medicare Open Enrollment to review all of that and see if the plan that you're on is still the best plan for next year, or if there's a better plan out there for you. So we talked about the changes that you can make during Medicare Open Enrollment. These are changes that are based on whichever option you've decided to go with for your Medicare, for insuring your costs of Medicare. So there's two options for insuring your costs of Medicare. You can go, you're going to be in one of two camps. You have a Medicare supplement policy, which is what we have here on the left. That means you're getting your Medicare Part A and your Medicare Part B directly from Medicare. Then you've purchased a Medicare supplement plan from a private insurance company to fill in the gaps in Medicare Part A and Part B. And then you also have a separate Medicare Part D prescription drug plan. During Medicare Open Enrollment, if you are in this camp and you have Medicare Supplement, the only thing that you can change is your Medicare Part D prescription drug plan during Open Enrollment. So the other option that you might, the other camp that you might be in would be you have a Medicare Advantage plan. So you can't have Medicare Supplement and a Medicare Advantage. You have one or the other. So you have two options. If you are on a Medicare Advantage plan, this is also known as Medicare Part C. This is basically a bundled Medicare plan. So instead of paying Medicare or getting your Medicare directly through Medicare, you're getting it through a private insurance plan, and it's bundling the benefits under Part A and Part B and prescriptions all together. It might have some extra benefits like hearing coverage, eye care coverage, extra things like that. It's a bundled Medicare policy. You can also change these during an open enrollment. And it's really important to review if you have one of these during open enrollment, because the plans, like I said, can change and the benefits can change, and maybe your needs change from year to year. So it's another thing that you can change during open enrollment is your Medicare Advantage plan if you're on one. So let's briefly review the parts of original Medicare and what they cover and what they cost, just to kind of go over what your outlay is and why it's important to make sure that you have a plan for insuring your portion of costs. So the bare basics of regular Medicare is you have Medicare Part A, and everybody gets this automatically when they turn 65. Medicare Part A, this is your hospital coverage. And by hospital coverage, it's inpatient hospital coverage. So Medicare has a rule called the 2-midnight rule, which means if your doctor has deemed you sick enough that you are going to have to stay in the hospital for 2 nights or more, then Medicare Part A will kick in and pay. If you have like an outpatient procedure, or if you go to the emergency room, or if you only have to stay in the hospital overnight, that's not going to be covered under Medicare Part A. That's going to fall under Medicare Part B. So most of your costs most likely are going to fall under Medicare Part B, and that's your medical coverage. So that's going to be doctor's services, any kind of like exams, if you have to have like x-rays or any kind of testing done, hospital stays if it's outpatient, if you have to go to the emergency room, durable medical equipment, which is like if you have diabetes, any test strips, any kind of diabetes supplies, if you ever have to get like a knee brace, or if you ever have to have a wheelchair for a while, or oxygen, anything like that would fall under Part B under durable medical equipment. So let's talk about the cost of each of those. Your Medicare Part A costs, almost everyone is going to get Medicare Part A for free. That's as long as you've paid into Social Security in your lifetime, you're automatically going to get Part A, and it's going to be a $0 premium. But you do have a deductible and copays associated with Part A if you do need to be hospitalized for more than 2 nights. So in 2021, the deductible was $1,484 before Medicare kicks in and starts helping pay. And all the numbers that I'm going to be going over today, as far as like premiums and deductibles go, are still going to be for 2021. Medicare hasn't released their 2022 numbers yet. They usually don't do that until kind of like smack dab in the middle of open enrollment time. It'd be nice if they did it beforehand, but that's just not how it works. So we don't have the numbers for 2022 yet. Usually everything is going to increase a little bit, but it's capped at a certain amount. And I'll talk about that in a little bit. So all of these numbers are going to be slightly higher for 2022, but it's not going to be a huge difference. So in 2021, it was $1,484. And then you have copays that you owe based on the number of days that you're hospitalized. So I think it's something like from 2 to 30 days, it's a certain copay that you owe. 30 to 60 days is a certain copay, and then 60 days and over is a certain copay. On top of that, $1,484. So your Part B costs, Part B does have a monthly premium. In 2021, it was $148.50. And that usually comes right off the top of people's Social Security. So they'll automatically take that out of Social Security once you're signed up for Part B. For high income people, they might have a higher premium for Part B. And I have a chart on this next page that will show what your premium might be depending on your taxable household and things like that. The premiums increase every year slightly, but they're capped at the cost of living if you're taking Social Security. So I think they just came out with the COLA increase for next year for Social Security, and it was pretty high. It was something like, I can't remember, 5.8%. or something like that. So that means this premium is not going to go up more than 5.8%. So you do have a Part B deductible and co-insurance that you'll owe on any care that you get so for 2021, it was $203, which is pretty low. After you pay the $203, you're going to pay 20% and Medicare pays 80% for most of those services that we talked about earlier that fall under Part B. Note, it's very important to note that this does not have any cap. So your 20% could be $20,000 depending on how much care you end up having to get throughout the year. So that's very important, a very important thing to remember when thinking about your kind of outlay of Medicare costs, worst case scenario. Here's that chart for high income individuals. Basically, if your household, if you're filing jointly, makes more than $176,000, then you're going to pay a little bit extra for your Part B, or $88,000 for an individual. So I'm not going to spend a whole lot of time on that. That's something that's pretty available on Medicare.gov, or if you have questions about it, just let me know. So your share of Medicare costs, your medical expenses that fall under Part B, which is going to be most things unless you have a big issue that requires long hospitalization, is going to be 20%. Again, there's no cap on that cost. It's not like a regular insurance plan where you have an out-of-pocket maximum. There's no cap. Your share of hospital expenses, those copays that I talked about earlier, after you've been in the hospital for 2 days, can be $371 a day to $742 a day. So I think if you're there for more than, I can't remember if it's 30 or 60 days, this is $742 a day, but that's a lot of money. Then you have your Part A and B deductibles, the Part A deductible of the about $1,400 and the Part B deductible of $203 before Medicare covers anything. And then prescription drugs are not covered under original Medicare at all. So you have to cover that separately, which we'll talk about here in a minute. So as you can see, Medicare covers the basics, but it still can leave you with a pretty large cost outlay, especially as people age and maybe start experiencing some more health problems or bigger health problems. You can leave yourself exposed to pretty high expenses if you don't insure your Medicare costs. So you have two options for insuring your Medicare costs. Option one is going to be a Medicare supplement policy. So with that, like we talked about earlier, in this picture, you get your Medicare Part A hospital insurance and your Part B medical insurance directly through Medicare as normal. Then you'd purchase a separate Medicare supplement policy and a separate Part D drug plan. Now, going with this option is a front-end loaded option as far as cost goes, which means you are going to pay higher premiums for this, but your cost outlay when you actually have to get care is going to be way less. And it's going to be completely predictable. And I'll explain that in a minute. So this is more a front-end cost-loaded option. Option two is a Medicare Advantage plan, also known as Medicare Part C. These are those bundled Medicare plans where you are not getting your Medicare directly from Medicare. You're getting all of your Medicare bundled into one plan, including your prescription drugs through a private insurance company. These are more back-end loaded, which means the premiums on these are going to look lower, but the cost comes into play when you actually have to go to get care. The costs are going to be a lot less predictable, and they are going to be much more expensive when you go to get care in most cases. These are the plans. These are the plans that you're going to see a whole bunch of commercials about and have been seeing commercials about on TV. These are the plans that they try to advertise as like free Medicare, basically, which we know that nothing's free, but they advertise these as $0 Medicare plans, or this is how I got money put back into my Social Security every month. And they offered me free eyeglasses and I can get, hearing aid coverage or things like that through these plans. The way that they advertise them is a little misleading. And I'll go a little bit more into depth about that as we go through each one of these plans. But as we know, nothing is free, and we'll talk about they still make their money, and we'll talk about how they make their money here in a minute. So Medicare supplement plans they're called Medigap plans. It's kind of their nickname, and that's because they cover the gaps between Part A and Part B. They kick in and they'll help you pay the deductibles, coinsurance, and copays that you would otherwise owe under Medicare Parts A and B. They're offered by private insurance companies, and you can sign up for them either when you first turn 65 or when you retire and go off of your employer's insurance, whichever one is later. That's when you'll sign up. And this is very important because this is the only time that you can sign up for a Medicare supplement plan without having to go through medical underwriting. So you get to sign up as guaranteed issue. This is important. This makes your decision when you first go on Medicare, the decision that you make between going with a Medicare supplement plan and going with a Medicare Advantage plan, very important, because you get open enrollment every year for a Medicare Advantage plan, right? You can sign up or switch every year during this time, October 15th to December 7th. But for a Medicare supplement plan, you only get one time to enroll for free without having to go through medical underwriting. So 10 years down the line, 5 years down the line, if you decide you don't like a Medicare Advantage plan that you went with and you want to switch to a Medicare supplement plan, it's going to be really hard because you're going to have to pass a bunch of medical underwriting questions. And, 5 to 10 years from now, you might not be in the same good health that you might be in now. So that's really important to note, that you have a one-time guaranteed issue option to sign up for these, right, when you go on Medicare Part B. So when you turn 65 or when you leave your employer's insurance. So these don't change every year. The benefits don't change for the plans, and they don't have an open enrollment every year. So it's important for these to think long-term and don't just shop for the price initially. The plans are standardized, and there's 10 different plans that you can choose from. In Nebraska, there's many different companies that will offer these 10 different plans, but each plan is going to offer you the same exact benefits, no matter which company that you go with. So for example, Plan G is the most popular plan in Nebraska, and I think in the entire country now. Every Plan G, no matter where and what company you get it from, is going to have the same exact benefits. So the only difference really between companies when you're making a decision with which company to go with is going to be the premium, and then their year-to-year premium increases. And so, like I said, the plans don't change at all from year to year, but what might change is your premium. As you age, it costs more basically to insure older people. So they have to charge you a slightly higher premium every year as you age, and your premium will go up usually just slightly on your policy anniversary. So when you are going to try to choose a company for your Medicare supplement plan, you want to choose a company that has a history of pretty low age-rated increases and has a big pool of insured people. Another thing that's really important to note about Medicare supplement policies that I don't have on this slide, but I really want to hone in on, is you can use your Medicare supplement policy all over the country. Any doctor or hospital that takes Medicare, which is almost everybody, is going to accept your Medicare supplement plan, no matter what Medicare supplement plan you have or what company that you use. So these are like nationwide plans. If you're a snowbird that goes to Arizona for the winter, you don't have to worry about whether your doctor or the hospital in Arizona is in network or anything like that. If you travel a lot, you don't have to worry about if something happens to you, if you're going to be able to get care, anything like that. These are nationwide plans, which is really great. The plan that I suggest to people, and it's the most popular plan, is Medicare Supplement Plan G. So this plan fills in the gaps everywhere for Medicare and Part A and Part B, except the Medicare Part B deductible of $203 a year. So that means you know exactly, if you have to get care in a large amount of care, you know exactly how much money you're going to be spending, which is literally $203 outside of the premium that you pay. So that's something that's really awesome about this policy. It kind of leaves no questions asked as far as your cost for care. It's also the most popular plan, which means it has a bigger pool of insured people. There's younger people coming into the plan every year that are just turning 65, which is really good for the plan as well. So that means that there's going to be a lower expected age-rated premium increases every year. That's a good thing as well. And I put the average premium in 2021 for Plan G down there. Basically, I would say probably about the average premium is going to be $130 a month, give or take. A lot of the companies have household discounts as well, which is nice too. So along with a Medicare supplement plan, those don't cover Medicare, and Medicare supplement plans don't do anything to cover prescription drugs. So you need to get a separate prescription drug Part D plan. And obviously those plans help pay for your prescriptions. They're offered by private companies. You have different options for providers, plans, and premiums, and they do change every single year. So the plans might change their formularies every year. They'll change their copays. They'll change their deductibles. They'll change their premiums. Everything changes every year. So it's really important. Even if you have a plan that you liked in 2021, it doesn't mean that it's going to be exactly the same next year in 2022. And maybe your prescriptions aren't the same as they were in 2021. So that's something that's really important to review every year. Like we said, and are going to reiterate, open enrollment is October 15th to December 7th. So for these plans, you are going to think short term and shop for price and shop for the kind of annual estimated cost of what your drugs will cost for the next year. So I really want to stress that the prescription drug plan that's going to be the best plan for you, or the most ideal plan, lowest annual cost plan for you, is going to be incredibly specific to your situation, meaning your specific prescription drugs and the dosage that you take, how often you order it, and where you get it from. So the best way to run quotes so that you have a fair comparison of the different plans and what they'll cost you is on Medicare.gov, and they'll open it up tomorrow for you to be able to log in on there. And you don't even have to have a login if you don't want to. But basically, you can go on Medicare.gov from the homepage, and you can plug in all of your prescriptions. You can plug in how often you get them, whether you get them mail order, whether you get them from a pharmacy, where you get them from, all those things. And then it'll come up with a list of the least costly to most costly plans estimated available for you for next year. So that's really the only fair and unbiased way I think that you can see all of the options that you have. The way that these plans are marketed is they're marketed by individual insurance plans. So like Humana will hold an event marketing their specific plans, and they might plug in your medications and show you what the cost is on their plan, but there's no comparison as to whether or not that plan is better for you or worse than you, worse for you than another plan with Aetna or Blue Cross Blue Shield or WellCare or whoever else. But on Medicare.gov, it'll show you all the plans that are available and which ones would be least costly for you. And if you need any help with that, I'm going to point you to a resource here at the end of this if you're not very comfortable on the computer, or you can call me and I'd be happy to help guide you through it too. So here's a brief overview of just a basic estimate of what the overall monthly cost would be. Like I said, these are more front-end loaded plans if you go with the Medicare supplement option. So the premium every month is going to be a little bit higher, but your cost for care is going to be very predictable, and it's going to be less when you actually need it. So the overall average cost, just hypothetically, and this is pretty good ballpark estimate, is going to be $314.50 a person, and this includes your Medicare Part B that's coming out of your Social Security every month. So let's move on to option 2, which would be your Medicare Advantage plan. These are sold by private insurance companies, and the private insurance companies, you're getting all of your Medicare from the private insurance company not from Medicare. So those Medicare Part A and B costs and benefits that we talked about earlier, you don't get those. You get whatever the insurance company and plan, whatever their costs and benefits are, basically. And how it works is these Medicare Advantage plans get money from Medicare for your care, whether you end up having to go get care or not, if that makes sense. So that's part of how they can swing these $0 premiums. And additionally, you end up paying more for your care. So even though the costs might look less, just upfront, less than the Medicare Supplement plan, they're still getting paid. You know, they're still getting their money from their members. So these wrap up your hospital, medical, and drug coverage into a single plan. And usually they have a little bit of an added like dental benefit, hearing benefit, maybe eyeglasses benefit on there that look very attractive to people. They work more like a traditional insurance company, like maybe if you've had insurance at your previous employer, a little bit more like how those work than how original Medicare works. They have a smaller percentage of people choose Medicare Advantage plans than choose Medicare Supplement plans. In Nebraska, it's only about 12% of people choose these Medicare Advantage plans. Something that I really, really want to caution people on with these, and don't get me wrong, these plans, for certain people, these plans might be good, but something I really want to caution you on is that these plans have a specific network of hospitals and doctors that you can go to. And if you go to a doctor or hospital outside of the plan's network, you have no coverage at all in many cases. And remember, you're getting all of your Medicare through this Medicare Advantage plan. So you don't even get regular Medicare coverage if you go to a doctor or hospital outside your plan's network. You pay everything 100% out of your own pocket. You have no insurance, basically, if you choose a provider outside of your plan's network. Now, this is very important because I have heard, since I've been doing this, stories of people who've been on Medicare Advantage plans and they've needed to go get care from like a specialist somewhere, like, you know, a clinic somewhere far away, like Mayo Clinic or something like that. And the Medicare Advantage plan, that clinic wouldn't be in their Medicare Advantage plan's network. So they have to pay everything out of pocket. That the Medicare Advantage plan won't cover anything. So if you travel or if you go live somewhere else during a certain part of the year, these plans are probably not for you. So that's something to really, really keep in mind and really be cautious about as well on these Medicare Advantage plans. Again, another thing that I want to talk about on these Medicare Advantage plans is just to remind you that you can switch Medicare Advantage plans every year, but you can't switch from Medicare Advantage plan to a Medicare Supplement plan without having to go through medical underwriting. So if you're thinking about switching, you know, you have a Medicare Supplement plan and you're curious about these Medicare Advantage plans that you hear commercials for, you know, all the time, especially during this open enrollment time, just know it's going to be, if you don't like your Medicare Advantage plan, it's really hard to switch back to a Medicare Supplement plan. You have to go through a lot of underwriting and you have to basically be in almost perfect health in order for that to happen. So the overall monthly cost estimate for a Medicare Advantage plan, you're still going to pay your Medicare Part B premium, which is $148.50. And I think you pay that directly to the Medicare Advantage plan. I might be wrong on that, but I think that's how that works. And then your Medicare Part C could be $0, or it could be, you know, this example, it's $44. Total being $188.60 just in this example. As you can see, that's less than what it would cost for a Medicare Supplement in Part D plan. But your costs when you go to get care are kind of made up for in that. Briefly, I want to touch for people who are not quite 65 yet and are going to be starting Medicare soon. I want to touch on when to sign up. if you automatically get Part A when you turn 65, and it should be free as long as you've paid into Social Security. If you have employer insurance and you are going to work past age 65, usually the employer insurance will work with Part A, but you'll still have Part A. If you're working past age 65 and you have work insurance, you'll want to delay getting your Medicare Part B, that's that medical insurance, until you retire and go off of your employer insurance. So basically, you're going to sign up for Medicare Parts A and B either when you turn 65, if you're retired, or at the time that you retire and go off of your employer insurance. At the same time that you go off of your employer insurance and enroll in Part B or turn 65, whichever one is later, you're going to choose whether you're going to go with the Medicare Supplement Plan or a Medicare Advantage plan, and you're going to sign up for those plans. You can do that online. You can do that through an agent or broker. We do Medicare Supplement plans here, and you can enroll that way. You're also going to want to enroll in a Medicare Part D prescription drug plan if you are choosing the Medicare Supplement option. So basically what you need to remember is you are going to enroll in Medicare either when you're turning 65 or when you retire and lose your employer insurance, whichever one is later. So if you're working past 65 though, you need to let Medicare know so that you don't automatically start Medicare Part B when you turn 65. You have to let them know that you're delaying it. And then when you retire, you have to let them know that you want to start it. So you'll need to sign up with them when you decide to retire. And you do that through the Social Security office, by the way. So if anyone has any questions, whoops, I'm going to go back to that screen share here. Feel free to type them in right now. I want to offer everybody a couple resources here in Lincoln that I think are really good and helpful for Medicare information. Aging Partners is a local nonprofit in Lincoln, and they offer unbiased Medicare advice. So they don't sell any kind of Medicare policies. So they can show you all of the plans that are available as far as Medicare Supplement, Medicare Advantage, and Medicare Part D, and they can run quotes for you and things like that, but they are not trying to sell you anything. So they can offer unbiased advice. It's really awesome. It's a really great place to go, especially if you're not comfortable on the computer and you need help on your Medicare Part D prescription drug quotes during open enrollment, or if you're on a Medicare Advantage plan, you kind of go through Medicaregov to run quotes on those plans as well, and they can help you kind of compare and contrast and plug in your medications and all that good stuff. So there's their phone number. If you need to look them up, I've talked to them before and they're super nice. They'd be glad to help you. Secondly, this Medicare and You handbook, they come out with a new, they come out with a new Medicare and You handbook every year, and you can order one to be sent to you for free on Medicare.gov, or you can download the PDF and read through it. It's just a really good reference book if you ever forget like what Medicare does and doesn't cover and the co-insurance percentages, things like that. Just highly recommend that you have one of those on hand for yourself. And I am happy to be a reference too. If you have any questions about your Medicare at any time, feel free to call me or email me, and I am happy to help. So it doesn't look like we have any questions at this time. Thank you guys so much for hanging out for this last half hour. It looks like I went a little over time, so sorry about that, but I appreciate your time and feel free to reach out if this has brought up any questions for you. Thanks a lot. Have a great day.